surgery. Next is a procedure called ALK, which cuts the tip of the cornea off the eye, reshapes it, and sutures it back onto the eye. Now, does that sound safe? Not only is it not safe in Dr. Dello Russo's findings, but it is also not precise and can't be used for astigmatism and farsightedness. ALK never enjoyed any degree of popularity with any refractive surgeon, points out Dr. Dello Russo, and PRK is again safer and more effective. More about a variety of ALK later. Now we come to two totally experimental surgeries, neither of which, in Dr. Dello Russo's opinion, will ever be approved by the FDA or gain any degree of popularity with any American eye surgeons. The first is ICR, where cuts are made all around the cornea so that pieces of plastic can be inserted in a ring-like fashion. As compared to PRK, it lacks safety according to Dr. Dello Russo, and is imprecise and not useful for high degrees of myopia, astigmatism, or even farsightedness. The supporters of the ICR treatment state that the advantage of the ring is that it can be removed if need be in the future. However, the New Jersey Eye Center points out that PRK is a permanent procedure, on the other hand, and a permanent treatment. Finally, we come to IOL. This last non-laser vision correction surgery involves actual placing of a hard or soft lens inside a healthy eye. Notes Dr. Dello Russo, this is hardly safe. This experiment is being carried out on a very limited scale. It will never get FDA approval, and probably no American eye surgeon would ever use this in the assessment of Dr. Dello Russo. Remember, PRK is confirmed as safe and effective in the vast experience of the New Jersey Eye Center. Now we can get to the main purpose of this video, laser vision correction. Laser vision correction is that exciting world of refractive surgery that you've become so much more aware of over the past decade. However, to add to your dilemma about the number of refractive surgeries, there are actually two laser vision correction procedures. They are PRK and LASIK. There's a lot more explanation involved, but you'll find it to your advantage to pay very close attention. We're only going to be talking about two surgeries of which there's some confusion. Again, Dr. Dello Russo and the New Jersey Eye Center would like to clear this up. In 1988, a prototype of a new laser was developed for the sole purpose of focusing a safe laser beam of ultraviolet pulses onto the surface of the eye so as to reshape the cornea and to eliminate the need for glasses for myopia, astigmatism, and farsightedness. So the excimer laser was invented and laser vision correction was born. The first person was treated in 1988, and since then, over 1 million people worldwide have been so treated. The technology has developed and advanced rapidly. As Dr. Dello Russo points out, there are now two types of laser vision correction. The laser was originally designed to change the shape of the cornea by treating the surface of the cornea in a one-step procedure, which was named photorefractive keratectomy, or PRK. What's the history of PRK? Well, in the United States, PRK underwent extensive testing at excimer laser centers like the New Jersey Eye Center between 1991 and 1996 for the Vizx excimer